So after taking a history from a patient that has hypertension or high blood pressure, the next thing that will follow is what? Physical examination. So it's after physical examination that you'll be talking about things like investigations and all the stuff, right? So we get to look at the physical examination for patients that have what? Hypertension or high blood pressure. All right. So for the physical examination, there are some things that you should note. So physical examination is more of like the patient came, they told you their own side of the story. So for physical examination is you as a healthcare provider now, you are trying to now look out and pick up some things that the patient must have possibly forgotten to tell you. Right? So for the physical examination, one thing you should note is the body habitus. So for the body habitus of the patient, you measure the weight, you measure the height. You know, there is one thing that, like somebody that has this particular height should have this range of weight. Do you understand? So if you are getting to see that for a particular height, the weight is still not the same, not in line, okay, you now start what picking up the problems. So so after you measure the weight and height, that's where you can be able to calculate the person's what body mass index. That's the BMI. Okay. Then you measure the waist circumference. Of course, there is an average waist circumference for women and men of different ages. Okay, so if you are seeing that the waist circumference is too high, you now start knowing that the person has what? Obesity. Okay. Then you also try to pick out signs of what? HMOD. Those are the hypertension mediated organ damage. Okay. So hypertension can have side effects on things like the brain, the heart, the kidneys, and different other things. Okay. So you want to pick out things like, do they have some neurological things? So you do some neurological examination. They try to pick out what cognitive status. They do what fundoscopy, where you are trying to what um access, okay, if there's any problems with the eye. That's what fundoscopic examination. Then you auscultate the heart and carotid arteries. You palpate for carotid and peripheral arteries. Okay, that's basically all those pulse taking. So you take pulse from the carotid side, from the femoral arteries, from the brachial arteries, from the frontal side and temporal artery and different things. The ankle brachial index, you do that. So you now also try to look out for what? Signs of secondary hypertension. So you check out for skin infection. So we want to look out for what? Kefolate patches of that's basically for what? Neurofibromatosis, also known as what? Pheochromocytoma. Then you palpate for kidney to check out if there's signs of renal enlargement. That's if the person is having a polycystic kidney disease. Then you auscultate the heart and renal arteries to check out if there's murmurs or bruits, which are indicative of what? Aortic coarctation or renal vascular hypertension. You check out for signs of Cushing's disease or acromegaly. Now you're trying to pick up if there's what? Endocrine hypertension. All right. Then you check out for signs of what? Thyroid disease. That one too is also related to what? Endocrine hypertension. So these are all the things that you'll be noting out in your physical examination for a patient that has hypertension.